Okay, so we're starting. Put on the full armor of God so that you can take your stand against the devil's schemes. Ephesians 6:11. So we're continuing with E. coli. E. coli is a gram-negative endo-positive rod. E. coli virulence factors. There's four of them. The first one is Fimbriae. Then there's P. pili. Then there's K. capsule. Then there's LPS endotoxin. So Fimbriae is Fimbriae. What is virulence factor? Virulence factor is something that the bacteria uses to get into our body. So E. coli specifically uses Fimbriae to get into our body and to cause cystitis and pyelonephritis. P. pili is what E. coli uses to cause pyelonephritis in our body. Now, another another virulence factor is K capsule. This one causes pneumonia, neonatal meningitis. Another virulence factor is LPS endotoxin. It causes septic shock. Okay, so Fimbriae. What is Fimbriae? E. coli, Fimbriae. These little projections are Fimbriae right here. And you can see the K capsule. It's a capsule that surrounds the E. coli for protection of the E. coli. And LPS is an endotoxin. Well, LPS endotoxin. LPS is an endotoxin. LPS lipopolysaccharide. Let's just double check though. Lipopolysaccharide. LPS lipopolysaccharide. Yeah. Um, LPS, which is lipopolysaccharide, is the major component of the outer leaflet of the outer membrane of the gram-negative bacteria. So it is the outer component. See this? It is the outer component of the outer leaflet of the gram-negative bacteria. So first we have K capsule, then you have the LPS, which is surrounding, which is right underneath the K capsule, and so the LPS is right between the capsule, like the K capsule, and the cell membrane. Okay, and now P. pilus. What is P. pilus? P. pilus is just another projection from the E. coli that causes pyelonephritis in it causes pyelonephritis. Maybe I can show you here. Pili. Okay, yeah. So right here, see this? This is the flagella of the E. coli, and this is the Fimbriae, and this is the pilus, which is slightly larger than the Fimbriae, and causes what? Pyelonephritis in in the patient. Now, K capsule, we just said K capsule of E. coli causes pneumonia, neonatal meningitis, and then LPS endotoxin causes septic shock. Now, there are four types of E. coli, and they all produce different symptoms. We're going to get into this. Intro-invasive E. coli is a microbe that invades the intestinal mucosa and causes necrosis and inflammation. This one is invasive. It causes dysentery, which is bloody diarrhea. Okay. Dysentery. Yeah. So dysentery is bloody diarrhea. It looks like Shigella poisoning. So, so that's that. Enterotoxigenic E. coli is produces the heat labile and heat stable enterotoxins no inflammation or invasion, um, produces heat label or heat stable enterotoxins that can cause watery diarrhea. So this one is known as traveler's diarrhea. It is always watery diarrhea. It is there's no invasion. There's no blood in the stool. Now what you have to remember is that this one produces heat label and heat stable enterotoxins. Heat label is going to increase cyclic AMP. Heat stable is going to increase cyclic GMP. Okay. All right. Now, enteropathogenic E. coli is one where there's no toxin produced, adheres to the apical surface, it flattens the villi, it prevents the absorption. So here, apical surface is the side facing the lumen. Apical surface is the side facing the lumen. It flattens that side out. So, um, okay, so right here we can see that, yeah, this is the lumen. So it's the side facing. So this is the villi, and if I said that um, enteropathogenic E. coli, enteropathogenic E. coli, there's no toxin produced, adheres to the apical surface, um, which means it sticks to the side facing the lumen. Side facing the lumen is? Okay, so the E. coli comes and affects right here, the side facing the lumen. Okay, all right, and then it flattens out this villi. Okay, it flattens out this villi, um, and so it prevents absorption of nutrients. Therefore, the patient gets watery diarrhea. Okay, because you can't absorb. I'm sorry, not water. Is it water? The patient just gets diarrhea. Traveler's diarrhea is water diarrhea. It just says diarrhea here, so I'm assuming it's just regular diarrhea. Um, Regular, yes, diarrhea. You can't absorb anything. You get diarrhea due to flattening of the villi. However, this can be reversed. The flattening of the villi can be reversed. Next one is enterohemorrhagic E. coli. This one is known as 015787, is the most common serotype in the U.S., often transmitted by undercooked meat, raw leafy vegetables. Um, Sugar-like toxin causes hemolytic uremic syndrome, which is a triad of anemia, thrombocytopenia, and acute kidney injury due to microthrombi forming on the damaged endothelium. So what happens here is that the sugar-like toxin, damages the endothelium of the blood vessels. So platelets come and try to seal off that gap that is inside the endothelium, and because the platelets come and try to seal off the endothelium, this is why you have microthrombi. And when you have microthrombi, the RBCs cannot get past this microthrombi, and they get sheared, which is why you have schistocytes. So that's why you have see, sugar-like toxin causes hemolytic uremic syndrome, triad anemia, thrombocytopenia, acute kidney injury due to microthrombi forming on the damaged endothelium. This is why you have mechanical hemolysis, which causes schistocytes on the peripheral blood smear. And then you have platelet consumption and decreased renal blood flow. Okay, so schistocytes. So let's see, schistocytes. So these are schistocytes. Normal red blood cells, schistocytes, become sheared because of the microthrombi. So right here, so sugar-like toxin comes and damages this part of the endothelium of the blood vessel, and then this is a bunch of platelets they come to repair the endothelium, and then they just get bigger and bigger. That's why there is platelet consumption, because all the platelets are being used up to fix the clot. I mean, to fix the repair, to fix that repair, right? So the platelets are forming a clot, and because of this, the RBCs cannot get by, and it causes the RBCs to be sheared. This ball over here causes the RBCs to be sheared, causing schistocytes. Yeah. All right. Now we explained why there's decreased platelets, because platelets are being used up for the clot, to form the clot, and there is decreased renal blood flow. There is decreased renal blood flow due to the increased microthrombi in the blood vessels of the kidney. Okay. So, intrahemorrhagic E. coli, it causes hemorrhage. Yeah, it causes hemorrhage because because it causes dysentery. So bloody diarrhea, you get it from hamburgers, and you get it from, and it produces hemolytic uremic syndrome. So yeah, so you had to know there's a mechanical hemolysis here, because schistocytes are being made. Next, Klebsiella. And so Klebsiella is a gram-negative. Oh, I forgot to mention. E. coli grows green on EMB agar. It is catalase positive, so it breaks down hydrogen peroxide before the host WBCs can come and use the hydrogen peroxide to kill off the E. coli. So E. coli is very smart. Okay. Now Indo positive. So it's gram-negative, Indo-positive. Indo-positive means that E. coli stains red. That's all that means. That's it. Next. That's everything you need to know about E. coli. Klebsiella. It's a gram-negative rod. It's the intestinal flora that causes low-grade pneumonia in alcoholics and diabetics, even when aspirated. You see very mucoid capsules, as in this picture over here. Is caused by abundant polysaccharide capsules. So Klebsiella has a polysaccharide. Okay, now dark red currant jelly sputum. The patients that have Klebsiella will have lobar pneumonia, and they will also cough up currant jelly type. See, this is the sputum. Okay, so this is the color of Klebsiella sputum. It looks like raspberry jam. Okay. Yeah. And the reason it's that color is filled with blood and mucus. Well, it's also a cause of nosocomial urinary tract infections. So it's associated with multi drug resistance. The reason for this is Klebsiella and Enterobacter serratia are all drug resistant because patients in hospitals take increased antibiotics, so some bacteria become resistant. So some bacteria become resistant. So that's why Klebsiella is a cause of nosocomial urinary tract infections. Okay, so something else you have to know is that Klebsiella is urease positive. What does it mean? What does it mean? Urease positive. Urease positive means that it goes and breaks down urea to make ammonia. That's what it means. So Klebsiella makes ammonia, and the Klebsiella ferments lactose. It is immotile. What else ferments lactose? Serratia and Enterobacter. So remember this, these are lactic fermenters. Klebsiella, Serratia, and Enterobacter. Serratia is bright red, motile, and ferments lactose. Enterobacter is motile and ferments lactose. Klebsiella is immotile and ferments lactose. Okay, so remember those three are lactose fermenters. Okay, so yeah. Um, things you have to know about Klebsiella is causes aspiration pneumonia, mainly lobar. It causes abscesses in the lungs and liver. It produces current jelly sputum. Diabetics get this. Alcoholics get Klebsiella. Okay, so I am memorizing as we go. Um, so feel free to fast forward or go at 1.5 to 1.75 speed if you're just revising, or if you're taking notes you can do 0.5. All up to you. Okay, all right. So Campylobacter jejuni, it's a gram negative. It's a gram negative curved comma shaped rod. um, comma or S-shaped rod with polar flagella. It is oxidase positive, grows at 42 degrees Celsius, so it grows over 100 degrees Fahrenheit. So Campylobacter likes to grow in the heat. It's a major cause of bloody diarrhea, especially in children. It is transferred by fecal-oral transmission through person-to-person contact or by ingestion of undercooked, contaminated poultry or meat. Unpressurized milk, contact with infected animals like dogs, cats, pigs is also a huge risk factor. It's a common antecedent of Guillain-Barré syndrome and reactive arthritis. So basically, somebody who has Guillain-Barré syndrome, they get uh, they will have infection with Campylobacter jejuni beforehand. Then they will get Guillain-Barré syndrome, and Guillain-Barré syndrome is a paralysis that starts in the legs and goes all the way up. So remember, it starts in the legs and goes all the way up, and they'll have infection of Campylobacter jejuni beforehand. Okay. All right, and there's another, and I believe there's a Euro question that talked about this. Basically, it was a kid, and he had a dog in a kennel, and he had symptoms of Campylobacter jejuni, and the reason was because of the dog. And I just remember dog and kennel. We'll go through it when we go through my year-old notes, but yeah, just remember that. Okay, so Campylobacter jejuni is transmitted by fecal-oral route. This happens because this bacteria is normally in the intestines of chicken, and when chicken is cut, these guts splash into the rest of the meat and infects humans when we eat it. Okay. Okay, next. All right, let's go. Vibrio cholera. All right, Vibrio cholera is has flagella. It is gram negative. It is gram negative, flagellated, comma shaped, oxidase positive, grows in alkaline media, endemic to developing countries. It produces profuse rice water diarrhea by enterotoxin that permanently activates GS, which will increase cyclic AMP in the body, and this is what causes the water to go into the intestines, causing the massive rice water diarrhea. It is sensitive to stomach acid, though. Like Vibrio cholera is will be destroyed by stomach acid. Um, that's what that means, acid label, and you need a huge amount of Vibrio cholera to it requires a large inoculum of Vibrio cholera to infect 50% of the population. All right, so you need a large amount of it. Unless the host has decreased gastric acidity. So if somebody that was on a protein pump inhibitors got if somebody that was on protein pump inhibitors got Vibrio infection, Vibrio toxin, they will get Vibrio very easily. But in an immunocompetent person or somebody that had normal functioning levels of HCl in their stomach, they would not. They wouldn't be as affected by Vibrio as somebody who has a decreased HCl production in their stomach. Okay, so remember somebody with that is on PPIs, and it's a risk factor for them to get Vibrio. Vibrio is transmitted by ingestion of contaminated water or uncooked food like raw shellfish. You treat promptly with oral rehydration. Okay, yeah, we're gonna get to just some facts we have to know about Vibrio. Cholera toxin activates GS, causing an increase in cyclic AMP. This causes secretion of water into the intestines. Oxidase positive means it turns purple on oxidase test. Vibrio grows in alkaline media. It grows in it grows in increased pH media, endemic to developing countries. So, causing yeah, endemic to developing countries. Cholera is mostly seen in developing countries due to lack of sanitation in the water. Um, and remember, Vibrio produces an enterotoxin that activates GS, causing increased cyclic AMP. And you need a high ID50 dose to infect a healthy person that has a lot of HCl in their stomach. Okay, so rice water diarrhea, to show you this so that you remember, you know what it looks like. There is nothing that will stick like a picture. See this? This is rice water diarrhea. Right, exactly. See, rice water diarrhea. This is actual rice water. That's why it's called rice water diarrhea. Okay. All right. Now, okay. So H. pylori. We're on H. pylori. Okay. H. pylori um, is a curved flagellated motile gram-negative rod that is triple positive. That is triple positive. It is catalase positive, oxidase positive, urease positive, and we can use urea breath test or fecal antigen test for diagnosis. Urease produces ammonia, creating an alkaline environment, which helps H. pylori survive in acidic mucosa. H. pylori colonizes the antrum of the stomach, colonizes the antrum of the stomach. How do you remember this? Antrum. This is the antrum of the stomach right here. I just remember that. H. pylori. H. pylori. How I remember is that. Okay. First you have antrum, then you have the pylorus, right? So I just remember that it's closer to your anus. So I just remember that the antrum is closer to your anus and pylorus. I just looked at the picture like 10 times. Because I always get confused between the fundus and the antrum and the pylorus. For some reason, I always switch it. But yeah, so the fundus is up here, then F-A-P, FAP, F-A-P. I think we'll go with FAP. Maybe that'll be easier. F-A-P. All right, so this is antrum is where the antrum is where the H. pylori like to infect. Okay, all right. H. pylori causes gastritis and peptic ulcers, especially duodenal ulcers. Risk factor for peptic ulcer disease. So H. pylori is a risk factor for peptic ulcer disease and gastric adenocarcinoma and malt lymphoma. So H. pylori can lead to gastric adenocarcinoma. Okay, most common initial treatment is triple therapy, which is amoxicillin and clarithromycin and proton pump inhibitors. Now, if the patient is allergic to penicillin, you give metronidazole. You give metronidazole and clarithromycin and proton pump inhibitors. Okay, so the initial treatment is always going to be amoxicillin, clarithromycin, and PPI. If the patient is allergic to amoxicillin, give metronidazole and clarithromycin and PPI. Okay, now you can also give bismuth-based quadruple therapy if concerned about macrolide resistance. What are the macrolides? The macrolides are erythromycin, any kind of mycin. Right? Clarithromycin. Let me look. Macrolide. Macrolide. Macrolides are erythromycin, azithromycin, clarithromycin. So yeah, um, if there's macrolide resistance, because we have to give clarithromycin, you give bismuth. Okay. All right. Bismuth-based quadruple therapy. If there is macrolide resistance. So what you have to know about H. pylori, H. pylori produces urease, and urease breaks down urea. After breaking down the urea, H. pylori produces ammonia from the urea, so H. pylori can survive. So remember we said something's urease positive, that means that it breaks down urea, which will cause ammonia, which will make ammonia. This is so that the bacteria can survive. H. pylori makes ammonia, so it can survive in the very gastric, in the very high HCl environment in your stomach. Okay, so catalase positive. If something's catalase positive, it is capable of breaking down hydrogen peroxide. Yeah, if catalase positive, if something is catalase positive, it is capable of breaking down hydrogen peroxide. Yeah, before the host the WBC can get to it. If something is oxidase positive, the bacteria. If something is oxidase positive, that's when the bacteria turns purple when doing an oxidase test. And urease, we just talked about it, makes ammonia so it can survive. Okay, so, and you remember how we said H. pylori causes acid, causes ulcers, especially duodenal ulcers? You want to know how that is? So remember how we said H. pylori makes ammonia. Ammonia is basic, creating a very basic environment in the pylorus of the stomach. So that now the pylorus senses this basic environment, and after sensing the basic environment, a pylorus tells the fundus to secrete acid, and then the fundus starts secreting the acid. Increased gastric and increased gastric. Yeah, so the fundus starts producing increased gastrin, and that increased gastrin causes ulcers. So this is the body's mechanism trying to fight back to a low ammonia, to a low too much ammonia in the body. So this is how the body is trying to fight back due to increased pH in the body. Yeah. So the body will try to counteract that and make it more acidic. But then when you do this, it causes peptic ulcers, especially duodenal ulcers. Okay. So that's why H. pylori is restricted for peptic ulcer disease, gastric adenocarcinoma, and lymphoma. The most common initial treatment is triple therapy, like we said, which is amoxicillin, clarithromycin, and PPI. If the patient is allergic to penicillin, give metronidazole and clarithromycin and PPI. If the patient is allergic, if a patient has macrolide resistance, which is any kind of MYCIN resistance, you give bismuth. All right. So H. pylori needs basic environment to survive, so it will try to decrease the acidity of the stomach, and the stomach will try to increase acidity as compensation, causing the ulcers. See, isn't that interesting to know? That's very interesting. It's very cool. So yeah. Makes the environment to survive, so it will try to decrease acidity of the stomach by making urea. Next time we'll try to increase acidity as compensation, causing ulcers. Alright, now we're on to spirochetes. Spirochetes, which are which are spiral-shaped bacteria with axial filaments. Includes Borrelia, Leptospira, and Treptonema. The only Borrelia can be visualized using aniline dyes, like Wright or Gemsa stain. Wright or Gemsa stain in light microscopy due to the size. Treptonema is visualized by dark field microscopy or direct fluorescent antibody microscopy. Okay, so these are spirochetes, spiral-shaped bacteria with axial filaments. Includes Borrelia, Leptospira, and Treptonema. Only Borrelia can be visualized using aniline dyes, like Wright or Gemsa stain. So Borrelia can be visualized using Wright or Gemsa stain. Again, I guess those stains use aniline dyes. Okay, in light microscopy, due to its size, it's big, so you can see it. Treptonema is visualized by dark field microscopy or direct fluorescent antibody microscopy. Okay, dark field microscopy. I always wanted to know what dark field microscopy was. Okay, so you see bacteria in the dark. Okay, dark field microscopy, syphilis. So this is syphilis. This is exactly what it looks like. So Treptonema pallidum is what causes syphilis. Okay. Alright, now we're gonna go on to Lyme disease. Okay. So Lyme disease. Lyme disease is caused by Borrelia burgdorferi, which is transmitted by the Ixodes deer tick, also vector for Anaplasma spp, and Protozoa babesia. So, okay, we'll get back to that. Natural reservoir in the mouse, so Lyme disease. It's naturally found in the mouse. Borrelia is naturally found in the mouse. Deer are essential to tick life cycle, but do not harbor Borrelia. Okay, so Borrelia is normally found in the mouse. Deer are essential to the tick life cycle, but they do not harbor Borrelia. Lyme disease is common in northeastern U.S. Stage 1 is early localized erythema migrans, typical bullseye configuration, which is right here. That's what the stage 1 of Lyme disease looks like. It's known as erythema migrans and is pathognomonic, but not always present. Stage 1 presents with flu-like symptoms. Stage 2 is early disseminated, secondary lesions, carditis, atrioventricular block, facial nerve palsy, migratory myalgia, transient arthritis. Stage 3 is late disseminated encephalopathy, chronic arthritis. Okay, stage 3, late disseminated encephalopathy, chronic arthritis. A key line to the face. So these are symptoms that Lyme disease causes: facial nerve palsy, It's bilateral, so both sides of your face, will droop. Okay. Arthritis, cardiac block, erythema migrans. Treatment is doxycycline, which is first line, and amoxicillin. Um, and if it's severe illness, like if you have a cardiac sign or heart block, you give ceftriaxone. Okay, so the first line is doxycycline, and then amoxicillin. Okay, so first line is doxycycline, amoxicillin, and you can also give amoxicillin, but if it's severe, you give ceftriaxone. How do you know if it's severe? If there's cardiac manifestations. Okay, so this Borrelia is transmitted by Ixod's deer tick. Ixod's tick also transmits Anaplasma species and Babesia. Remember Babesia. It's like the Lyme disease, the thing that causes Lyme disease, the thing that causes babesiosis is transmitted by the Ixod's tick. Babesiosis. What is babesiosis? See, babesiosis. It's by the Ixod's tick. What are the signs of babesiosis? Flu-like symptoms: fever, chills, sweats, headache, body ache, loss of appetite. Okay. Okay. So that's what. I'm gonna just make a note of that. Let's see. Lyme disease. Borrelia. And anaplasma. And anaplasma. And Borrelia, anaplasma, and Babesia. All transmitted by Ixod's tick. Okay. Now the stage 1 is early localized erythema migrans, which is that red rash, looks like a bullseye. Let's see. And stage 2 is early disseminated secondary lesions. Carditis, AV block, facial nerve, Bell's palsy. So on both sides, it will droop. Your face will droop, and you get arthralgia, transient arthritis. Stage 3, you have chronic arthritis, encephalopathy, late disseminated. Okay, treatment is doxycycline first line or amoxicillin. If it's severe, you give ceftriaxone. All right. Let's see, can we do this? Yeah, we'll do Leptospira and then we'll continue with syphilis on another video. Leptospira interrogans is a spirochete with hook-shaped ends found in the water contaminated with animal urine. Leptospirosis is a flu-like symptoms, myalgias, especially of the calves, jaundice, photophobia with conjunctival suffusion, so erythema without exudate, prevalent among surfers and in tropics like Hawaii. Okay, oh yeah, you got animals peeing in the water. Okay. And Weil's disease, icterohemorrhagic leptospirosis, severe form with jaundice and azotemia from liver and kidney dysfunction, fever, hemorrhage, and anemia. Okay. So spirochete, it's a hook-shaped. Okay, spirochete with hook-shaped ends, found in water contaminated with animal urine. Leptospirosis, flu-like symptoms. Yeah, flu-like symptoms, myalgias, classically of the cows, jaundice, photophobia, with conjunctival substitution. What is that? Conjunctival, conjunctival suffusion. Suffusion. Eye condition occurs during the septic phase of leptospirosis. Oh, I see. Oh my goodness. That don't look good. Okay, so that's what that is. So, photophobia with conjunctival suffusion, erythema without exudate. Okay, so it's just a very inflamed, red, and without exudate. It just means that it's not runny, right? I think that's what that means. It's not runny. It just looks extremely inflamed, and yeah. Okay. Oh, hold on. Let me see. Okay. So that's what that is. So it's not runny. It's highly inflamed, and it's seen in leptospirosis, photophobia. They can't see light. Prevalent among surfers and in the tropics, like in Hawaii. Whales disease, icterohemorrhagic leptospirosis, icterohemorrhagic leptospirosis, severe form with jaundice, and azotemia from the liver and kidney disease. Okay. Oh, icterohemorrhagic leptospirosis is a severe form with jaundice. It's a severe form with jaundice and azotemia from liver and kidney dysfunction, fever, hemorrhage, and anemia. Azotemia. Okay, azotemia. Azotemia, medical condition characterized by high levels of nitrogen containing compounds such as urea, creatinine, and other nitrogen-rich compounds in the blood. Okay. So this is when waste builds up in your blood because the kidneys cannot work. Okay. So that is ectohemorrhagic leptospirosis, severe form with jaundice and azotemia from liver and kidney dysfunction, fever, hemorrhage, and anemia. Okay, we're gonna do syphilis in our next video. Okay, all right. See y'all then.